Hi, my name is Susadhi. I'm going to be doing continuous heparin and a chest tube dressing change. So I'm going to do my first check here. So I'm going to be comparing, my doctor's orders to the MAR, and I have the PDM for IV continuous heparin I've already looked over. So Wendy Holmes, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9. They're 35 years old. Okay, we have the right patient. We're going to be giving heparin for VTE, and that's what we have, heparin, so correct drug. We're going to be giving it via IV continuous, so that's the route. Correct time is now, and we're going to be giving it for 1,350 units per hour as the rate. And it's going to be a 25,000 unit bag that we have already hung, prepared by pharmacy. So I can go to my patient's bedside, safety check. Hi there, my name is Susadhi. I just do hand hygiene. I'm going to be a student nurse for today. I'm just going to be administering the heparin there. So you had some blood clots, so your doctor ordered the heparin just because we want to take care of that before it gets any worse, right? Okay, so can I just check your wristband here? So we have Wendy Holmes, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 35 years old, no allergies. Can you tell me your first and last name and your birth date? Do you have any allergies? No, okay, perfect, thank you. So what I'm gonna do is, I'm just gonna come to the bag that's already down here. I'm gonna make sure, so we confirm my patient. We have heparin. We have the 25,000 units, which is correct. It's a 250 ml bag. We have the final concentration of 100 units per ml. We're going to be giving it via IV continuous. And the correct time is now. We have 2 nurses' signatures here. Okay, so I'm just going to make sure this is the right tubing here. We have primary tubing with no ports. We have the normal saline and running TKBO via gravity. It's already attached to my patient. The Y is primed. Everything is primed. We know that the patient's IV is patent. So I'm just going to program my pump now. So I'm going to colleague guardian this. Oops. And then we're just going to go down till we find heparin VTE. There we go. So now, like I said, we're going to be giving 1,350 units. 1,350 units per hour. That's going to be a rate of 13.5 ml. Okay. So this is all good. I'm just going to. This is already primed and everything. Swap for 30 seconds, let it dry for 15. Just gonna make sure that stays sterile. We see the bleb of fluid there, so we know it's primed. There we go. Okay, so I'm just gonna quickly do another med check, make sure everything is programmed right. We've confirmed the patient, Wendy Holmes. We have heparin, correct drug, right route is IV continuous. We're going to be giving 25,000 units, so that's the right dose. It's already pre-mixed. 250 ml, 100 units per ml is a concentration. Correct time is today and now. 2 nurses are signed. That's good. Correct tubing, everything is okay. So this is colleague guardianed to heparin, and we did the 1,350 units. And now, double checking that, I'm going to call my second nurse. She's going to come in and she's just going to verify my patient, my heparin bag, and the pump programming. She's going to confirm it, so it's all good. Okay, so I'm just going to press start, and I'm going to tell my patient, confirm primary, sorry. Start. Okay, so I'm going to watch for the 3 drops. Good. I'm just going to sign my MAR. I'm just going to get my second nurse to also sign my MAR. Thank you. So if you notice any bleeding or bruises, you just let me know, okay? Okay. So now, I'm just going to be changing your chest tube dressing. Is that okay? Yeah? Thank you. Okay, so I'm just going to take a look at it first, okay? Just going to position my patient. I'm just going to move this completely out of the way. We'll move it back after. Is that okay? Good. So as you can see, this is a completely occlusive dressing. The tube is tented. There's no dependent loops. There's no kinks in it. It looks good. We're going to follow it down to the collection chamber. So it's set to the correct suction that the doctor has ordered. We see the orange ball there. We know that it is suctioning. there is a correct amount of fluid here, and there's no jacuzzi bubbles. If there were the large bubbles, I would get another nurse and we would just assess for the leak, because that would indicate an air leak. We can see titling, and that's what we want to see as the patient inhales and exhales. I'm gonna look at the drainage, and I'm just gonna mark it at the beginning of my shift with a marker, just so you know. I'm gonna follow the section all the way up and make sure everything is plugged in and it's set to suction continuous low in the green, which is correct as per ordered. We have here sterile water, normal saline, and we have the clamps as well, just in case there's an emergency. We have all the emergency supplies and kits. Okay, so now I'm gonna redo their dressing. I'm just gonna get rid of this. Is it okay if I just borrow your bed for a bit? Thank you. I can set up my garbage bag. Okay. I'm just gonna get my forceps out. Okay. I have a new container of normal saline, it's not expired. I'm just gonna carefully pour. There we go. Okay. Without crossing over the field there. I'm just going to wing this packaging back. Take out my IV drain sponge. Just throw that out. I can just move it a little bit here, still within my sterile border. I think I might have crossed over my sterile border there when I went to put my normal saline away, so I would just get a new kit and restart. I'm gonna open my Gelinette. And just pop that right there. Okay. I'm just gonna do hand hygiene. Okay, so again, this looks good. So I'm just going to remove this old dressing. I'm gonna stabilize the chest tube. It would be stitched into my patient, but sorry. There we go. There we go. And remove all that. Okay, so this is just garbage. I'm actually just gonna use my blue forceps here, stabilize the tube, take out this old Gelinette. That's also garbage, but trust me. Just gonna do hygiene again. Okay, grab some new gloves. I'm just gonna assess it. It looks good. There's no signs of infection, no redness, no inflammation. Okay. So I'm gonna clean it now because I've already assessed it. I'm just gonna take my forceps. I'm just gonna go right here. It's still sterile. It's within my 1 inches for sure. Dip it in, and I'm gonna start right at the or closest to the insertion site. Go around, pull that out. 1 swipe per wipe. Dip it again, and we're gonna go a little farther out. Throw it away. Dip it in, go even further out. Okay, so I think that's fairly clean. My forceps are still sterile. It did not touch my patient. I'm going to also clean the tube just in case while we put the dressing on, anything touches it. So I'm just going to very carefully lift, clean the bottom of the tube, making sure my forceps are not touching the tube or the patient. Go, dip it in here, clean the top as well. So I've cleaned it, I've dried it, I've assessed it, or I've cleaned it and I've assessed it. I'm gonna now dry it. I'm gonna take a large 4x4 just to clean the surrounding skin. Oops. There we go. So I'm just gonna clean the entire area that I just washed. Throw it out. I'm gonna dry the bottom as well of the tube. And again, just making sure I keep my forceps sterile. Dry the top. Okay, clean, dry, but assessed, looks great. I'm gonna just, I'm gonna do my gelinet here. So this is just garbage.
That's true. I guess we didn't think that through, so we had the little vials that were
I think my finger might have touched this, so we're gonna pretend that I got a new gelinet and just put it back in here. I'm gonna twirl it like this, and
pull the airplane mode. You guys watch me. I can pull up my calculator. Didn't know that.
I'm just gonna put it right here.
Makes sense.
Making sure it's nice and occlusive.
10 minutes remaining. 10 minutes remaining.
And kind of just press it in. Again, making sure it's nice and occlusive. We don't want any air going in. This is just garbage. I'm gonna put new IV. So this is not draining at all basically, and it's nice and occlusive with the gelinet. So I'm just gonna do one going opposite directions. Like so. We're gonna put 4x4 right on top. You're still doing okay? Good. There we go.
You know, I'm just checking the bedside, making sure nothing's.
Okay, so I have my Mefix here. This is garbage. And I'm just gonna make sure this is a nice occlusive seal because we don't want anything going in there.
Daniel just went by.
There we go. Okay. Nice and occlusive there. You can just add a piece of tape there. And I can get rid of my gloves. This one I have initial timed and dated. Again, making it fully occlusive here. And I'm gonna tent the tube here. You can add a little piece right there and tent again. But other than that, my patient is okay. I'm just gonna put this down, put their arm back down, throw everything out, sharps in the sharps. I'm gonna make sure the bed rail's up, call bell is within reach. My patient's bed is in the lowest position, throw the garbage out. They're doing okay with the heparin. I would reassess their ABTT in 6 hours and then titrate to the doctor's orders and protocol. My MARs are signed, my patient is doing okay. I'm just gonna exit, do my safety check, and I would just IPN the care that I gave and my assessment of the chest tube site as well.